Welcome to True Health Tuesday, and the truth will set you free. Okay, tonight, the future of healthcare. So, and I'm talking about reintroducing critical thinking because now with the toxicity of the therapies being so freaking deadly, and with the liability being taken away from a lot of medical procedures like vaccination, okay? So, and had an interesting conversation with a patient today. She's 36 years old, and she has a leaky gut, and I'm thinking, you know, well, and she's looking at me, could vaccines be a contributing factor? And I says, well, kind of, but you know, you're 36 years old, so you would have had around 48 to 50 vaccines. And I said, now if you were 25 years old right now, you would have had around 54 to 60. But if you were under 25, you would have had around 72 vaccines. And I'm going, God, this is stupid. Okay, because it's an assault on the immune system. We're seeing a massive rise in immune system issues. So let's just reintroduce critical thinking, which means that you're presented with a problem and you got to look for a solution. And I like this. To think is sacred. Let every person think freely. To express what you think is sacred, let every person think is thought freely. If you do this, you will prove that you're a conscientious and moral human being. If you don't, just declare yourself being a fascist. Okay, now, if you like history, and I think history is really, really cool. Okay, when you're talking about President John F. Kennedy, this was in his inaugural speech. And I want this because we got to excite that passion. You know, don't ask for what you would do for your country would do for you. What would you do for your country? I mean, this was an exciting time. So think in 1961. Yes, I was a year old, okay? But you know, it's more than that. We're looking at the Russians, okay? Nuclear power. We're looking at nuclear war. You know, the communists are invading everywhere. I mean, real dynamic. And we just got out of a couple of world wars. And this was right in the middle of his inauguration speech. So I mean, look at the tempo. We dare not forget today that we are heirs of that first revolution. Let the word go forth that from this time and place to friend and foe alike that the torch has been passed to a new generation of Americans. Born in this century, tempered by war, disciplined by a hard and bitter peace, proud of our ancient heritage, and unwilling to witness or permit the slow undoing of those human rights to which this nation has always been committed, and to which we are committed today at home and around the world. Let every nation know, whether it wishes us well or ill, that we shall pay any price, bear any burden, meet any hardship, support any friend, and oppose any foe to assure the survival and success of liberty. This we pledge and more. Wow. That doesn't pertain to this generation because they weren't born in this century, and you're not going to see speeches like this. Okay, so when he talks about revolution, the revolution has to happen now. Okay, that's it. We're losing a generation. So this is going to be the future of healthcare. We are literally going to start to live in harmony with our world and in harmony with our bodies. We're not going to be living in an infinite expansion in a finite universe, okay? And we can do that by understanding the parameters. This is the future of the clinics, okay? And literally, we're going to be setting these up around the world. Okay, we're going to start off in Rosarita, and then we're going to expand into Greece, Italy, and Spain. Imagine this, a village that's off the grid. I mean, self-supporting with the environment, growing their own food, creating their own electricity, but also advanced stem cells, x-rays, detoxing facility. I mean, this is going to be a rejuvenation center, but then also an education, so people are educated on how the body works. I mean, imagine like a Greek mystery school on steroids. And this is going to be spreading throughout the world. So, future of healthcare. But let's look at insanity today. What if you thought that high blood pressure, type 2 diabetes, back pain, neck pain, inflammatory bowel disease, and anxiety, we're just going to take this. Because according to the official medical deities, yes, that's what MD stands for. Thank you, sir. Okay, medical deities, okay, that these are idiopathic. Nobody knows. They're just a mystery. How about we do a little investigation? Okay, so critical thinking is an analysis of facts to form judgment. Is that done now? No, measles are dangerous. Avoid them. Run. The plague. Turn your neighbor in. They didn't get vaccinated. They're evil parents. Okay, that's not critical thinking, and that's not based in science. Those are inflammatory statements that are designed to make you ignorant and keep you stupid. Okay? So, unbiased analysis of factual evidence. I like this. So let's take this apart. Now, how does the body really adapt to this environment? And this is adding critical thinking. We have an automatic nervous system. One part keeps you alive under stress. The other part regenerates tissue. One part is sympathetic, and this is supposed to be activated short term in the day to keep you alive. However, physical, chemical, and emotional stress will trigger this sympathetic dominance or this sympathetic activation. And what does that do? That suppresses the parasympathetic. So God, you start looking at this, you think, well, wait a second. If you're in a sympathetic dominant state from physical, chemical, and emotional stress, which is what our entire population's under, particularly Americans, then that means the parasympathetic is depressed. So that means slow gastric motility. That means a lot of different physiologic responses are going to be actually intelligent responses. So does this mean that under these type of influences that you could be misdiagnosed with adrenal fatigue? Why is everyone misdiagnosed with adrenal fatigue? Because the adrenals don't function outside of the body. Okay, what's the most important organ?
Heart. Brain.
Heart's a good one, except heart won't function without the brain. Is the brain a good one? Okay, that won't function without lungs. Okay, come on. Let me hear. Intestine's good. Yeah, of course, that's kind of full of shit. Okay, but then the intestines is the enteric brain. Okay, it communicates. So there isn't one important organ. Okay, you say the appendix, no, you rip that sucker out. That's designed to repopulate the intestinal tract. If you've had your appendix removed, you got a 60% increased risk in colon cancer. So every organ is important. It's designed to function in harmony. But in stupid world, we look at each different part and try and separate each one out. So it doesn't work that way. If you have physical, chemical, or emotional stress to the extreme beyond your adaptability, your adrenal glands will be activated and you'll be misdiagnosed with adrenal fatigue. Why? Because does anybody have a car? Yes. What happens if the red light comes on? Is that red light syndrome? What? You mean it means the engine's a problem or something, right? Okay, yeah. You see how stupid it is? Adrenals don't operate outside. They're not going to just fatigue out. So then start expanding this out to everything. Low thyroid, high thyroid. What's the thyroid issue? The most common cause is Hashimoto's, and that's unknown. No, let's look at this. Under physical, chemical, or emotional stress, the sympathetic nervous system activates. The adrenals are also activated and thyroid is suppressed. Could the thyroid be suppressed because of low nutrients? Absolutely. Could the thyroid be suppressed because of systemic inflammation, causing the adrenal glands to produce more cortisol, causing the thyroid? Absolutely. But this is called critical thinking. Okay, stuff doctors aren't doing anymore. Gee, you got a high TSH, okay, and a low T3, T4 here. Take the Armour thyroid. Oh, you got fatigue, hair falling out? Shit, let's give you a thyroid. Let's not even think about why. Do you understand? This is crazy thinking. Poor sleep and fatigue. No problem. You got poor sleep and fatigue. By God, we can get you Lunesta or some cool sleep aid that adds on an average of 12 minutes sleep a night. That's what most sleep aids do. Now, however, it is linked to dementia, Alzheimer's, brain damage, and the side effect is fatigue. And you can't really drive the next day if you take it the night before. So that doesn't really friggin' work, does it? Okay, slow gastric motility. Let's say constipation. I saw a commercial the other night, so if you're on opioids, which, a good hunk of America is, because if you have pain, we must give you a pain reliever. Yes, can't have symptoms here. Okay, so slow gastric motility, this is constipation. Could that be an indication of physical, chemical, emotional stress causing the slow gastric motility? Abso-friggin-lutely. But you can't talk about slow gastric motility if you're at the orthopedic guy because you got pain. You got to go to the gastroenterologist. No problem. What's the orthopedic guy going to do? He's going to give you some good opioids because he's got nothing else. Okay, and that opioids is going to back you up. So then you go to the gastroenterologist and he'll give you a drug to counteract the effect of the opioids. Low stomach acid. Okay, we do talks on all of this stuff, but I want you to develop into the psychosis or the delusion of diagnosis and the psychosis of giving toxic therapies for the symptom without looking at the underlying cause. This is crazy world. Low stomach acid. You got a stomach here, you got a muscle on top. It's called the lower esophageal sphincter. On presence of acid in the stomach, this muscle tightens up, keeping acid in place. Now, if there's low stomach acid, that loosens up that muscle. So this means if you're eating food and drinking water at the same time, you dilute the acid, and this is going to cause reflux. But now let's say that you have great health insurance. You can get a proton pump inhibitor, the little purple pill, for 24 hours of relief. However, that increases esophageal cancer because it decreases the acid. It stops mineral absorption, so you end up with heart palpitations, cardiac arrhythmias, brain problems. It's a whole host of hell for low stomach acid to solve this. Wow, crazy. I had a patient in here this past week too, and all the patients I got that we're going to go through are from this week or a couple of weeks before. Weakened immune system response. Let's say somebody has Epstein-Barr virus or Lyme disease or mold sensitivity or multiple chemical sensitivity syndrome. Have you ever heard of that? Abso-friggin-lutely, everybody has. Okay, is it really the mold? Think about it. 100 people get exposed to the mold. Are they all going to have an issue? Or is it an immune system response? Is it really the Lyme disease? Like everybody in here gets bit by a tick. Are they really going to develop Lyme disease? No. So then you start looking, wait a second, it's not the pathogen that's the causative factor, it's the weakened immune system. Anxiety, stress, impulse control. Okay, yes, that's frontal lobe damage. Okay, from head impacts. No, I'm not going to hit my head. Okay, but yeah, I know it's been hit enough. Okay, so when you look at this, anxiety, stress, depression, those are all symptoms of the frontal lobe. Bipolar disorder, schizophrenia, all frontal lobe dysfunctions. The cerebellum stimulates that frontal lobe. So now when we start looking at this, what's toxic to the frontal lobe? We know the gut, inflammation, leaky gut can negatively affect the frontal lobe. So why do we give anxiety drugs like supposed to be selective serotonin reuptake inhibitors, the SSRIs, even though they say the clinical pharmacology, nobody has a freaking clue what these things do. And we do know they cause anxiety, stress, depression, suicide, and suicidal thoughts. Why? What's the reasoning behind that? When we know it's a frontal lobe dysfunction, then that's affected by a leaky gut and altered stimulation of the cerebellum. So we can change that. Blood pressure, blood sugar, it doesn't make any sense. Okay, so let's take a patient. Okay, and I'm just going to walk you through, and this is called critical thinking. Not, oh, that person is the back pain person, not the 42-year-old sweet gal with back pain and knee pain, okay? This is a back pain patient, so you must do these type of therapies. Did you ask her if she had the flu shot? I don't know. I don't care because that's not effective. Okay, you understand? It's like crazy world. So if you look, low back pain, knee pain, and neck pain. If you see the picture of her knees up there, you'll see the shadow thing called a patella that's laterally deviated. It's supposed to be in the middle. So that means that part of her knee pain is coming from abnormal patellar tracking. So the knee pain is really not a problem in the knee. It's a symptom of the knee coming from a dysfunction of the discs in the low back. How do we know that? Because see that crooked picture of the person standing up on the left? That's her standing up straight. Okay, we're looking at multiple traumas there. Now, if you look close at the top of the thoracic area, there's a massive right rotation of the vertebrae up there. Now, these are the nerves that supply the heart, the sympathetic nerves. So when you see that, you're talking cardiac arrhythmia. So I looked at this x-ray and I said, wow, you didn't tell me you had heart palpitations. And what did she say? Well, they're not really that bad. They're, I notice them occasionally. I said, well, okay, we shouldn't fix them then until your heart stops, okay? Then we'll really pay major attention to them. And then she looked at me and she how did you know? I can read a friggin' map. Okay, and then you look, sympathetic dominant state, that chart on the bottom left. This is measuring the autonomic function. So she's coming in. What would she do for, and this has been hurting her for decades. I mean, you can see degeneration on the films. So how long has she been hurting for? 5, 10 years? What therapy are you going to give that's going to correct the shape of the spine and alter that autonomic imbalance? Muscle relaxant, pain reliever, anti-inflammatory. Can you see how psychotic that is? Well, what about this? Chronic pain. If you have anybody in chronic pain for 6 months or more, it shrinks and ages the brain. It literally is altering brain function. And this is if you give an anti-inflammatory or give a drug to cover up the actual symptom. Mind-blowing. Pain of 6 months shrink the brain 10 to 20 years. If this were actually true, if this was a good fact, we would have an epidemic of dementia and Alzheimer's. Oh, we do. 45 years old. This gal came from West Africa. Really, really cool. Okay, gal, but see the steel rod in there? Now, this was for scoliosis correction. Okay, now they still do these steel rods. Now, you put a steel rod in a 10-year-old. Don't think that she's going to grow. No, that's bad, okay? I'm just trying to calm down and get in the mindset of a medical doctor, okay? That's going to put a steel rod in a 10-year-old kid, not understanding that scoliosis is not a problem of the spine. It's a problem with proprioception of the central nervous system. That you can stimulate the body to alter the brain so you can change the dynamics or the firing of the spine. This is how we correct it. Okay, you do pre and post x-rays and you don't correct the scoliosis completely until that person reaches skeletal maturity between 18 and 25 years old. And so do we see here. We see degeneration, advancing degeneration in the neck. I can't tell you how many patients were doing okay, got a surgery, and then they developed tremors or shaking. Because the brain has to have constant sensory input from the body. If you put a steel rod in that, okay, then you get limited influence. So the brain's going to send motor impulses down to regenerate or to re-stimulate that brain. You'll see before and after x-rays here. It might be hard to see, but we're looking at a change from this to this. Granted, it would be really cool to have more mobile vertebrae to work with, but this is what we got. We only got the top 2 thoracic ones and the rest of the cervical. So what does that mean? Does that mean that if you are focusing in on symptoms, because we're a symptom-oriented society, without addressing the cause, this adds further stresses and puts the patient into more stress, causing further adaptation? Let me word that in English. You cover up a symptom with a drug, you get the side effects of the drug. Okay, and we're the most drug population on the planet. Okay, so we look at the 2 terms. Idiopathic, think of idiot, they haven't a clue at what the heck the problem is. And this is the majority of conditions out there. So this is high blood pressure. Okay, this is inflammatory bowel disease. This is most kidney diseases. And when you look at, in defense of the Center for Disease Control and Promotion, Center for Disease Control and Prevention. Okay, when you look at these guys, they're saying 60% of Americans have a chronic illness or disease. And most of these are either lifestyle factors or unknown. And iatrogenics worse, because that's just causing it. Now, this is kind of cool. Okay, so we're looking at 55 years old, 25 years of pain. Okay, do you think she's gone to a couple of doctors for this? Yeah. And sweet gal, sweet like you can't believe. Her and her hubby are like one of the cutest couples ever. But you can see the body posture on the left, her head is massively forward. Okay, why is it forward? Because that head going forward is opening up the vertebrae on the back. This is her defense posture. If she stood up straight, that's going to compromise the sympathetic nerve supply to the heart at the top of the thoracic area. So when you see people rounding over like that, that's a protective mechanism. Now she just had neck pain. She's trying to avoid surgery. And I'm going surgery and shots. Okay, have you heard of a tactical nuclear weapon? Okay, correlate this with minimally invasive surgery. This is a friggin' neck. You're going to stick needles and knives in there to do something. That's not minimally invasive. Okay, this is serious. You're looking at a reversal of the curve that she comes up with. What's that? We should get the curve back to normal? I think that's a good idea too. Okay, so since the discs are alive, you can see before and after she's starting to get the curve back. That's fantastic. But what happens if you ignore the pain or you don't look at the cause? And ignoring the pain, I think, is taking a Motrin, Advil, Aleve, anything, because that's still ignoring it. It's not addressing the cause. It's not honoring the body. It's not saying, wow, we got to find the problem. How many kids with attention deficit disorder have come in here? Do you want to know how many? Lots. I'm talking well over a couple hundred. Okay? And what I do, and this is pretty much a kid from 15 down to 5. Okay? And I'll say, okay, buddy, you've been diagnosed with a problem with paying attention. And you know what the kids are doing by this time? Looking down at the floor. I'm the 10th doctor. They don't want to be thought of as defective. And I said, well, I'll tell you one thing. Any doctor that told you that's wrong. And then they start looking up. And I'll say, do your parents tell you got to play more video games today? Get back in that room and start playing more Donkey Kong. Okay, I don't know. What's the game today? when Donkey Kong was big when my kids were little, okay? But you know what the kids say? They start smiling and they go, no, man, I could play for hours. Then you don't have a deficit of attention. You have a frontal lobe dysfunction. And this is a part of the brain that I'm going to show you how to regenerate. I'm going to show you how to focus it because, buddy, you got laser beam focus. You don't got a deficit. You got this laser beam focus where you could focus in for hours on anything that you want to focus in on. So I'm going to give you that superpower. And guess what? They're cool. But what state of their brain do you think it's in? They're in a sympathetic dominant state from physical, chemical, and emotional stress. Their enteric brain, the gut brain, is absolutely destroyed from the vaccines, antibiotics, and toxic food. They're and what are we going to do? I know a class 2 narcotic sounds like a good approach. Let's give them amphetamines. Okay? I know, it's nuts. And I've told parents, I said, look, stimulants have a calming effect in kids. Right now the medical world gave them a class 2 narcotic called an amphetamine or Ritalin, or you could call it Adderall, which is ADD for all, good advertisement. Okay, and number one drug traded on college campuses. Hell, you can chop it up, snort it, shoot it. I mean, great stuff. So it's a good idea to start an 8-year-old on this stuff. And so I'll tell my that's sarcastic, by the way. I don't think kids should be, because there's about 4 people saying, I knew I was making the right decision. Good God, I'm so glad the kids are on Ritalin. Okay, no, give them a shot of espresso, like organic coffee, and it has a calming effect on the kids. I told that to one parent, and she said, well, isn't coffee bad? Not as bad for a developing brain as class 2 narcotics. Okay, so the longer a person has chronic pain, the more the brain shrinks. Okay, this is huge. So if you're not addressing the cause, that's crazy. Here we go. Again, 75 years old, 30 years of neck pain. What does he have? Reverse curve. This is a stress x-ray next to him. What are we looking for? Oh my God, the curve restores. It means that we can correct it. How about just getting a little tiny force loading in there to restore the curve, which is what we should be doing. However, if you look at the top of his ribcage area, again, he has a lateral deviation. Did this 75-year-old have heart palpitations? Yeah. And he was literally afraid to tell his sweetheart because at 75, you know what the big goal at 75 is? To be 76. Okay, let's set attainable goals. And so you want to say, well, if I got heart palp, instead of saying, wow, yeah, you got 2 nerve supplies to the heart. You got 1 parasympathetic supply up here, that's cranial nerve 10. You get the sympathetic supply in the top of the thoracic area. Let's check both. Let's make sure your body's functioning correctly. I mean, it just makes sense. Giving a non-steroidal anti-inflammatory, how could this be ethical, moral, scientific? There's no reasoning behind it, okay? Because it destroys the building block of cartilage. It'll make you temporarily, partially comfortable. Okay, it destroys the lining of your intestinal tract. So this way you increase intestinal permeability, causing a massive histamine response. It can cause kidney damage. There is no basis to use this. And then when people come in and say, well, I do take the 5 Advil a day. Okay, but why? And they'll look at me, well, because I hurt. I said, it's not working, you still hurt. Okay, yeah, but it takes the edge off. No, it doesn't, it's destroying your body. Okay, there's a lot of alternatives that you can do. How about omega-3s, fish oil? Or how about my favorite, find the problem. Okay, if you have a joint problem, restore the nerve supply, blood supply, and biomechanics, and the joint starts to heal. What you're going to see is typically people don't have knee problems, but they're going to have an unstable pelvis, altered mechanics of the firing of the patella, the firing of the quadriceps. You're going to have altered calf mechanics, altered foot mechanics. So look at every structure in the body and restore it, because it works. Again, chronic neck pain. Now see this person standing up. Do you think that in this body posture that perhaps we should drug them? Or should we fix it? Knowing that you've got the neck, and this is where cardiac arrhythmias are coming from. 97% of all headaches. You're talking carpal tunnel syndrome, rotator cuff problems, golfer's elbow, tennis elbow. These are all double crush injuries beginning in the neck. And it's just mind-blowing. Okay, now, non-steroidal anti-inflammatory is linked to dementia. We have a 1-in-1 dementia in this country. Dementia is not a normal part of aging. Autism is not a normal part of childhood. Okay, these are pathologies that were damaging our species. 53-year-old with knee pain. And again, looking at his knees. Last month we had 3 people that said they were bone on bone, and one of the patients came in and she questioned the doctor, because you can see there's a space in those knees at the top, right? You can see that it's not touching. Okay, and she asked the doctor, because he says, yep, it's almost bone on bone. She says, well, I don't know, I can see a space there. How dare you question the medical deities? Okay, just shut up. Okay, listen, follow the advice, take the toxic chemicals, and then sign up for the surgery that's dangerous. No, or regenerate the disc. Do you know what I mean? Now, they're in a low-functioning parasympathetic state. We're looking at massive deviations, whiplash trauma. Why are we taking a picture of the neck when someone comes in with knee problems? Because during the examination, they're talking to me like this. Do they have a neck problem? No, it's fine. It doesn't hurt at all. And I'm saying, no, you had some kind of problem in the past. Well, yeah, but that was 30 years ago, and it was a snowboarding incident, but it doesn't hurt at all now. Dude, you're driving me crazy. Today I had a patient, and I'm interviewing her mom, and her mom was sitting all messed up, forward rotated in. She says, really? You think I have a shoulder issue? Yeah. So I brought the daughter, I sat in her chair, and I said, look at mom. Okay, wow, because really you see stuff, but this is called observation. Controlling blood pressure with a chemical. Okay, what is normal blood pressure? Your body is self-healing and self-regulating. If you're lifting weights, it should be 200-300 systolic, okay, for short periods of time. What does the government say? You know, in America, in 1994, they said it should be 120/80. In 2004, they said it should be 115/75. This means the 400-pound, you know, retail store owner should have the same blood pressure as a 12-year-old girl gymnast. You know, none of this stuff makes sense. And then in 2004, the 115/75, they had to change that in 2014 because so many people are stroking and passing out because you're limiting oxygen to the brain. Okay, it has a warning label on the blood pressure drugs. This one says if you're taking more than one, it's dangerous. If you're taking 3, you're in more trouble because you can stroke out. Why? Because the blood pressure drugs work. Your body needs oxygen at this level. What that level is, it's up to you, based on dehydration or stress level or oxygen need or the efficiency of the blood. Now, 2 weeks ago when we talked about the health of the blood, you saw that under stress, the blood cells can start to clump together, so their efficiency is bad. So guess what? Instead of blood pressure here, you're going to need it here. So what happens is you take a chemical, it lowers blood. Now, you've got the pump, right? This isn't the only pump for the body. You've got all the arteries that constrict and dilate. So if you take a chemical bypassing your natural blood pressure regulation that lowers it, bam, the arteries are going to constrict. Like putting your thumb over the hose to get that pressure back up because it needs it. Now, if you have thick, crappy blood because of chronic stress and your body constricts, guess what? That can interrupt the blood flow. Hence, what do they say? We want to raise the issue that despite great advances in a pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Because they're not understanding that if the blood is not efficient, pressure has to increase. If you're had a toxic influence that's damaging the kidneys, that has to increase. If you've got a toxic lifestyle and the arteries are getting smaller from atherosclerosis, the blood pressure has to increase. So blood pressure will increase as an adaptation, not a pathology. Wow. Okay, now this one. 3 bypass surgeries and epidurals shot in the neck. This means that you can see this person has a reverse curve in their neck. A reverse curve. Now, degeneration, but not degeneration consistent enough where it's totally fused. So she still can get the curve in the neck, but she went to an orthopedist. He's not going to utilize his hands to cause an inflammatory response or to change the biomechanics to restore the curve. He's got knife, needle, and drugs. Okay? Just like the Symptom episode. You know, frankly, Homer, all we do is drugs and surgery. You know, those chiropractors are miracle. Between you, me, and the golf game, it's, you know, I mean, I love the surgeon in there. It's true. Anybody in here think that shooting this person's neck with an epidural will help the curve? No. Okay, knowing that the more shots you put in there, the more damage there is. I mean, they got a limit now to 4 shots. And when I first started this in the early 90s, I had a gal that came in. She had 23 shots of cortisone in her arm. It had swollen up like a balloon. I don't know what ended up happening to her, but if you have had wrist pain back then, they would shoot you, okay, with cortisone. If you had wrist and elbow, then they'd do 2 more shots. If you had wrist, elbow, shoulder, they do 3 shots. If you had wrist, elbow, shoulder, and everything, they do another shot. So 23 shots of cortisone, arms swelled up like crazy. I don't know if they amputated or not, but that's insane. This is not lack of a needle. Okay, so we look at this. She has already taken Norco, ibuprofen, a blood pressure drug, potassium, because the blood pressure drug is causing her to lose potassium, and that's going to throw her into cardiac arrhythmias. And we're looking at already at the top of the thoracic area, cardiac arrhythmias. Now, these are patients from our clinic. I didn't go through how I found this, because normally I spend around 4 hours on a Sunday building this. Okay, I didn't. I got stuck with some buddies because we had a motor problem on a sailboat. That means I had a whole afternoon off, which was, you know, thank you God. So I sat down Monday and I'm pulling up all the cases of people that we were currently seeing today, and I just randomly picked some cool ones. But can you see how this is crazy? Now, a bypass surgery, 80% of all bypasses clog again within 5 years. So did they fix the problem? No, knowing that arteries can be cleaned, knowing that heart attacks have a neurologic component or neurogenic component, and we're looking at the sympathetic nerve supply to the heart still altered, they're just missing it. Total critical thinking. Complications associated with epidural steroid injections: aseptic meningitis, arachnoiditis, bacterial meningitis, conus medullaris. Of course, they occur after multiple subarachnoid injections. It's nuts. I mean, I've never seen anyone with injection deficiency syndrome. Okay, 49 years old, 20 years of neck pain. We're looking at a loss of curve in the neck, but look at all the deviations in the rib cage area. Multiple trauma after multiple trauma. Now, why is this important? Because 90% of the nerves that come off that spine, there's no pain fibers. So have you ever heard of the guy super healthy, having a great time, golfing Sunday, dies of a heart attack Monday? All the time. How many times have you heard of somebody, oh my gosh, they got cancer, but they went through the chemotherapy, surgery, radiation, they're in remission, shit, it turned back up in the liver. Okay? Because cancer is an adaptive metabolic process, it's not from lack of chemotherapy. Okay? This is an adaptation to physical, chemical, and emotional stress, and the body will do everything to survive on this planet. But without looking at the actual source of the problem, the doctors are missing it, and there's not critical thinking. One of the basic principles in treatment stated by Hippocrates is first do no harm. Stories of medical remedy causing more harm than good have been recorded from time immemorial. It would be impossible to provide benefits of modern medicine if reasonable steps in diagnosis and treatment were withheld because of possible risks. Absolutely, absolutely. Except, what's the benefit of modern medicine? If you're talking about a chemical to alter physiology, that is not a benefit unless you're bleeding out and you have some emergency. Okay, for health, it doesn't work that way. We're looking at a reverse curve in the neck on the left. We're looking at loss of curve. I mean, fibromyalgia, this is one of the most devastating conditions. Nobody knows what causes it, okay, unless you actually look at the patient, look at their x-rays, look at their stress level, then you know that their causative factor of this is physical, chemical, and emotional stress. You identify that, you correct all three, the people get better. If you try and treat it with chemicals, it doesn't work that way. This gal stopped her meds December of last year. She's doing better. She's in sympathetic dominant state, but we're actually seeing the curve get better. I mean, rib pain, neck pain, right side for 10 years. What do you think, what kind of therapies were offered to her in those 10 years? Drugs, surgery, physical therapy. You know, they're going to work on the muscles. No one's going to do a thorough assessment of the structure and the neurologic components associated with that. And some people will only fix the structure, but they'll ignore the nutrition aspect or the deep sleep aspect or all the other aspects that a person has. Why? Because that's their specialty? Screw that. They got to change their specialty. This is what you need to assess a body. Remember, only 10% of the nerves that come off your spine have pain fibers. Okay, that means 90% of it. To be aware, 90% of that nerve has to be compromised for you to be aware of it. Stress x-rays, heart rate variability, thermoscan, live blood cell analysis, range of motion, palpatory, thermography. I mean, there's so many things that you can do to assess it. But why would you want to use all of these tests to see how a body works? Because we're not looking to control the thyroid or to control the adrenals or to help the intestinal tract, because those things don't malfunction. They're all responding correctly based on the environment. These are the questions that you got to ask. If you want to check your body, you know, what test, doc? Tell me the test. I want to make sure because stupid runs in my family. Okay, I mean, wait, no, strokes run in my family. Heart attacks run in my family. Flat feet run in my family. No, flat feet don't run. Okay, so you look at all of these things, okay, and they're setting you up for fear and ignorance. Okay, and none of this stuff is true. It's all delusion. 100% of the time, people come in here. Doesn't matter what they got. How many bowel movements a day do you get? Oh, doc, I'm really good there, you know, 1. Yeah, but I got to do the coffee enema and all the herbs, and then, man, it's 1. Good gastric motility or poor gastric motility? Survey says poor, you know. So what are we thinking about? Sympathetic dominant compromised nerve supply, knowing that this is 80% of the immune system. This is where neurotransmitters are. Is that gut function important for the health of the overall tissue and body? Knowing that you got slow gastric motility, does that mean that the inflammatory process is going to be up there because it's inflamed, it's not moving, you're not eliminating waste products. So what's going to happen? Adrenal fatigue, low functioning thyroid, backed up liver, poor bowel production, poor hormone production, all of this stuff from that first question. Now, sleep patterns. How do you sleep? Really good, man. Amazing. Yeah, I get up 3 or 4 times to pee, you know. I'm fatigued all the time, but I fall asleep really good. Sympathetic dominant or good sleep patterns? Poor sleep patterns. So bunion formation, that means pelvic instability. I'll have everybody take their shoes off. Why? Because bunions don't form. They're actually an adaptation to the compromised nerve supply, okay, blood supply, altered mechanics. That is the biggest clue. And then you find out with bad bunion formation, what'd you have? Oh, hysterectomy. I had prolapsed uterus. I had this, that. I mean, all of that from that. Medications. Find out how long it's been prescribed, okay? And we're getting 8-year-olds on blood pressure drugs, okay? What was it prescribed for? Imagine a 1.5, 2-month-old kid taking antacids because they're spitting up the genetically modified formula because the mom couldn't give milk because she was given Pitocin. Honestly, that's our clinic. It's crazy. Okay, we need this Dr. or Mr. Spock in here, Lieutenant Spock or Captain Spock, in here to do that Vulcan mind meld to change their mindset of reality. Say your doctor is killing you. They're crazy. Okay, they'll give antidepressants for sleep medications. Okay, and today I went in. This gal had 14 medications. 3 of them were for allergies. And I said, why are you taking this? Well, a year ago, I was coughing and sneezing. The fires were really bad. And I said, are you still taking it? Yes. Well, you know, the more you're taking an antihistamine, the more damage to your brain you get. Okay, they're called anticholinergic interrupters. I mean, they're really, really bad for brain function. So, well, if I don't need it, I shouldn't take it. Right! That's true. Okay. History of trauma. I mean, you'll get, you know, we had this one guy, 87 years old. He went kiteboard, okay, and he only does it on perfect days. But he was thinking about a trauma 30 years earlier. So when you get somebody 60, 70, 80, 90 years old, they were an adventurer. They were riding motorcycles. They were doing skiing. You know, they had fractures or trauma. Last week, this Canadian guy used a tree to stop him coming down on a slide because he didn't want to break his sled. Yes. Marcel, I'm talking to you, buddy. I love you, man. I mean, these are cool guys, but they're tough, but they were hurt 20 years ago, okay? And then what's the diet like? I mean, today we can't export a lot of our products to other parts of the world. It's crazy. So let's change the philosophy. We're going to add critical thinking. This means that every person on the planet is responsible for your own health. Okay, when you go to a doctor in this dark age, time, equate it with back in the 1300s. When you had an ill, that came from sin and evil spirits. And of course we know it's not sin and evil spirits now. Now it's measles and heredity. Okay, your great uncle had it, you're going to have it. Thank goodness we have medications to control it, so when it hits you, it won't be as bad. Yeah, no, forget that. That's allopathetic. Okay, that's changing symptoms with a chemical that doesn't work. Okay, vitalism means your body has a life force energy, that your body is designed to live on this planet, to thrive on this planet. Go on, somebody asked me what kind of mattress you're going to use. No. Okay, I'm going to turn you into 12. What happened when you were 12 years old and you did the sleepover? Did you say, gee, Bob, got to make sure I have a good mattress? No, man, you're sleeping underneath the couch, you're sleeping in the back of the truck. That's cool, that's normal, that's human. Okay, we're going to change that. So what do we know so far? The nervous system controls and coordinates every function. Your body's going to adapt. That's that automatic function. Anyone have an argument with that? Hell no. Meet me in the parking lot. Brain responds to the environment through the nervous system. Does this mean your perception of reality, if you perceive it as dangerous, sympathetics fire. You perceive it as safe, parasympathetics. Absolutely. Genetic expression, it's not genetics, it's genetic expression. You can suppress a cancer gene, you can express a cancer gene. Physical, chemical, emotional stress can be misinterpreted. Effectively dealing with the stressor can reduce or eliminate the lack of ease, the dis-ease. My God, think of that. Does that mean that most of these diseases are just an adaptive physiologic response? How about antioxidants? Well, for one, we get people all the time coming in here, and I'll touch their skin and it'll turn white. Okay, particularly I'll do it on the feet because that's where the most blood toxins show up in the legs and feet anyway. And I'll say, wow, you have a histamine response. So that means that you have some type of systemic inflammation going on. And I'll tell them an antioxidant is great. See, inflammation is how the body heals. We're causing inflammation on these tables, but a local specific inflammatory response to regenerate the disc and to restore proprioception of your body's position in space. It's really cool. But inflammation can create free radicals. Free radicals can damage healthy tissue. So inflammation is a healing process, not a dragging, attacking you. And if you do a chemical assault on it, like an Advil, Motrin, or Aleve, that stops that process, you destroy the body. Okay, you get food with extra antioxidants in there. They give up electrons, they deactivate those free radicals. So when I say anti-inflammatory foods, they're not. These are foods that promote healing by utilizing the healing aspect of inflammation. Does that make sense? Plus it looks pretty damn good. Okay. Oranges. Yep, bell peppers have 4 times the amount of vitamin C as oranges. Fantastic. Add this to the diet. Why? Because your body becomes what you eat. You are what you eat. Yeah, who wouldn't want to be a papaya? Okay, then you look at vitamin E. Okay, I mean, look at this. Look at the food. Let food be your medicine and medicine be your food. Okay, it just makes sense. Vitamin A, and I mean, this is just, start looking at your diet, looking at your lifestyle, looking at everything. I mean, I put this thing up all the time because this truly is how your body is going to adapt and thrive on this environment. You can see that with that autonomic nervous system, you got to get the nervous system checked first before anything. Why? Because that controls and coordinates every function. Exercise, this is to move it, but also, what does movement do? It stimulates the cerebellum and that controls the frontal lobe. So does movement, is this one of the treatments or therapies for anxiety, stress, depression, bipolar disorder, impulse control, memory problems? Yeah, just think of the ancient masters. I mean, what would Einstein do? Okay, when confronted with a problem, he'd smoke a little tobacco and go for a walk. Okay, how many times have you seen that, somebody was confronted, I'm just going to go for a walk and clear my head? No, that symmetrical stimulation triggered the cerebellum, and that helps thought processes. Proper nutrition. If man makes it, don't eat it. Okay. And we fire, Bayer, Monsanto, the whole glyphosates that's in our water, because we get patients from all around the world. Man, there's a swath around our country on either side of the Mississippi. It's a cancer belt. And everyone's coming in with all sorts of mold issues, everything else. I mean, it's nuts. Sufficient rest. You're designed to sleep correctly. And if you follow the sleep, and I've got, I think, 5-6 videos on sleep, watch it. Master it. This is when your body regenerates tissue. It's that important. And then prayer and meditation. Okay? You're having a few minutes a day to calm down, to deep breathe. What does that do? Stimulates the parasympathetic nervous system, increases your rest, digest, and repair. How about doing that a little bit? I mean, is this popular? Yeah. Transcendental meditation. I mean, there's a bunch of it. Christ did it. Buddha did it. I mean, it's like common. This is, if masters and smarter people than you did it, I would do it too. I do it, okay? So now we've got Extreme Health Academy. I'm transferring all my videos over there because eventually they won't be allowed, or they'll be censored by the parties that be. Go to Extreme Health Academy, type in Bergman, like my name, 14, and you get 2 weeks for free. But get on there, look at all the forums, because I guarantee you, out of the thousands of people that are on there, you're going to find somebody that's had a similar condition and found a solution, and they're better. Okay, and then the middle to the end of November, we got Puerto Vallarta. That's going to be a blast. If you haven't been there, we're on the south side of the bay. It's going to be just spectacular, okay? I totally recommend it. We're going to be teaching from 8 to 12, maybe 1, and then we'll be on the beach hanging out, you know, discussing philosophy, life, or how to parasail. Okay, it's just going to be fun, okay? And then the cruise in 2020, okay? I've never been to Greece. I've never been to Israel. I've never been, I mean, this is a lifetime cruise. This is going to be really fun, but I totally recommend it. Okay, now, we can take a couple of questions. Any questions? Because next week we're going to talk on brain health. Yes, ma'am.
I just want to make a statement. I was blown away when you talked about...
Okay, I've got the only mic and we're live. So anything that you say, I'm going to repeat.
Oh, okay. It was a whole thing with proprioception and scoliosis. I'm blown away. Because I had a son that was floppy. I mean, I called him like he was like Gumby. And I just kept my eye on him, and I thought, he's got no proprioception. And one day he fell off the curb. He was on the curb, and I thought, let's see if he knows he's... So, I still haven't really solved that thing. He's 28 now. But my brother saw that he had scoliosis. He had to lay down at the beach, like just lean over at the beach. We saw a specialist, but what I'm wondering is there anything now that, you know, he...
Okay, now I'll just concise it and repeat it for the camera because I have the only microphone. Okay? Scoliosis has a proprioceptive component, and that's one of the most major components, and you thought that was really an interesting finding.
Exactly.
Okay, well, here's the cool thing. Okay, the body has natural curves front to back. You got a lordosis, kyphosis, lordosis. Okay, in scoliosis, they're missing the curves. They're missing the kyphosis. They have a reverse curve in the neck over here. And you have these joints that run down either side of the spine. They're called facet joints. So by restoring the front to back, you're changing these sensors on either side. And proprioception, you've got the intrinsic muscles of the spine. These are little tiny muscles. I mean, we're talking half the size of my pinky. Okay, and they have 4 times the amount of muscle spindle receptors. So they're for sensory. Do a little movement, but they're mainly for sensory. The ligaments have sensory component. The facet joints have joint mechanoreceptors. So all of these structures are involved to tell the body, am I standing up straight or am I standing crooked? This is why, and I've never seen this before, using biofeedback and corrective chiropractic to see how fast a scoliosis will change. And then utilizing thermography, so how the body is firing, and live blood cell analysis to check the motility, the platelet count, I mean the structure of everything. So we're using the mind and the structure to change those. Have you ever heard of that study? No, we're going to be doing it in 2 months in Mexico.
Biofeedback.
Yes.
Can you
totally cool stuff.
A little bit about that?
Well, biofeedback has to do with how your brain is firing. Okay, and so you put you've all seen the cool hat with the little tiny electrodes going everywhere. You set this on their head, have them watch a couple of things, videos, see their eye movement, see how the brain's firing off, and then that gives you a map. And then they put glasses on that flash lights in their eyes and sound, so you affect the visual and auditory stimulus to change the way the brain fires. So you change how the pathologic firing into a normal firing, and that may help proprioception. I know. It's got to.
But if his
again, I have the only microphone. Thank you very much. Yes, ma'am.
Do you normally see curve problems in people that have Hashimoto's?
Do I normally see curve problems in people that have Hashimoto's? There's not a curve problem, but in Hashimoto's is going to have an increased intestinal permeability. So that's going to be vaccines, medication, toxic food, or compromised nerves. That's a fact. Okay, there's going to be an inflammatory process which is superseding the activity of that adrenal gland. Okay, and then Hashimoto's, is that hyper, hypo, or both? So both. You're right, good. Okay, so it's not hyper and it's not hypo. So we're looking at an endocrine problem. Now, but also it's not really the thyroid. There could be nutrient problems, there's going to be gastrointestinal problems, there's going to be some other type of problems. So now, just for the heck of it, what kind of questions do you think that I would ask somebody with Hashimoto's? Oh, what a great idea. Okay, and then you find out, well, heck, it's not Hashimoto's anyway. Okay, there is going to be an autonomic imbalance, and there's going to be physical, chemical, emotional stress. Hashimoto's does not exist. But the adaptation of physical, chemical, and emotional stress do. If you're trying to fix the thyroid that's supposed to be Hashimoto's, what is the Mayo Clinic says Hashimoto's is from? Unknown. Idiopathic, haven't a clue. Okay? And what's the most common cause of thyroid disorders? Hashimoto's, according to the Mayo Clinic. Okay, you see how crazy it is? You look for the physical, chemical, and emotional contributing factors. You do not have a thyroid problem. You do have a stress problem. Okay, guaranteed. Okay, it's time. Next week, for sure, we're going to talk about brain function. And that's really cool, okay? Thank you very much.